listening to, watching, hearing, smelling, tasting, and feeling sex, drugs, and skincare. Like and subscribe. Hey, welcome back to Sex, Drugs, and Skincare. I am Nikki Davis Jr., licensed something, and no, I'm a licensed comedian, stand-up esthetician.
Nice. There we go.
Yeah.
That was good.
With me as usual is Sandro
Hello.
Iocolano.
Hey, I'm usual.
You are usual.
Thank you. I'm right here.
You're very unusual, actually.
I am very unusual, but that makes me very usual.
That's true.
Yeah.
You're very useful.
Thank you. That was good use of words.
You got anything?
I love unusual people.
Oh my God.
See, there we go.
She fits right in. All right. Well, the person you're listening to right now, by the way, is we haven't seen her. I feel like it's been years.
It's been a while.
Yeah. And
Eons.
Eons, yes.
We're both wearing the same outfit. What
We're
are the
like
chances?
4,000 years older.
I know. Luckily, we've been
You wouldn't know it.
I know. We look amazing from all of our, what do you call those things?
Stimulation. We're stimulating our collagen.
Well,
And laughing.
and laughing.
Mhm.
Yes, exactly. I know. That's
Happy
like,
people look better.
they really do. Yeah. Well, first of all, I'm going to introduce you, Dr. Jenn Tabiza.
Hi.
Your name of your practice is
Total body aesthetics.
Total body aesthetics.
It's a
Okay,
more
I always
fancy
want to
twist.
say a different word. So
Yeah.
okay, good. Well, let's carry on with that, and then
Yes.
also I wanted to ask you about radio frequency after we get through what you were just talking about. Like-
Oh, laughing?
yeah.
Well, laughing just basically reduces the cortisol in your body.
Oh yeah.
That's the stress hormone.
Yeah.
And cortisol ages you very quickly. That's basically the long and the short of it. So anything that makes you feel more lighthearted, happy, laughing. There was even a story I remember. Did you guys ever read that book, The Secret, back in the day?
Yes.
Do you remember
Yeah,
it?
yeah, yeah.
There was a story in there about a woman who got an early cancer diagnosis and she refused treatment. So she spent every night watching stand-up comedy or comedy movies and laughing with her husband, and then retested 3 months later and the tumor was gone.
Whoa.
So, I'm not necessarily saying don't get
You're
treatment.
not advocating laughter. I'm not condoning laughter here.
But no matter what, that just kind of shows that our bodies do know how to heal themselves. We're a little miracle. We just have to learn how to use ourselves as technology.
Yeah. Give it a little push.
So basically, you're in tech. You're biological tech by producing
oh
laughter.
my gosh, I didn't even know.
Yeah.
And I didn't even go to school for it.
Yeah. You get a biological tech disruptor. That's what
Start a
people.
program.
Yeah. I think that's what all startup people say
It's
about
like
disrupting.
you're basically a doctor.
Yeah. I basically. Yeah. I am. And yes.
That's so funny. It's like he just keeps saying, but I'm basically a doctor.
I'm going to do that from now
Yeah.
on as I introduce myself, and I'm basically a doctor.
I reduce cortisol. I
Yeah.
save
Yeah,
lives.
exactly. Well, tell me about I'm dying to know about radio frequency. People are saying some people are like, it's crazy to don't do this. What are you doing to your skin? Other people are like, I swear by it. I don't even really understand the technology of it.
Have you ever had it done?
No, I haven't had anything done. I need to have things done.
You look great.
Well, thank you.
You're just laughing yourself
That's it.
through life. You're doing awesome.
I want to get PRP, but we'll
we get
talk
all the
about that.
unhappy people who need help.
Exactly.
I'm joking.
They're stupid.
So, okay, yeah, radio frequency is a hot topic, but I want to kind of set the record straight, as I have to do regularly when I talk about this.
Yeah.
Radio frequency doesn't inherently melt fat. When it's used properly with a device that can stay 42 degrees Celsius or lower, what it actually does is produce collagen and elastin. It's a form of an injury.
So wait, just before you continue,
Yes.
they're using it for fat, and are they using it on their face too?
Yes, we can talk about how we use it for fat loss because
Uh-huh.
that's a separate topic.
Oh, gotcha. Okay.
But there are so many devices like Morpheus and Sulfurm X that do use radio frequency, and they can be really great. Where the fear comes from is early on when radio frequency devices first came out, there were a lot of operators that didn't know what they were doing. They were not trained properly on these devices, or the device quality matters. So some devices, I'll leave them unnamed, they don't have precise internal temperature gauge. So imagine you're doing the treatment
Oh my God.
and you really aren't getting an accurate reading of what temperature I'm at. You might be at 41.5 according to the device, but you're actually at 43.
Yep.
And this did happen, right? So people did experience fat loss from these devices. But a device like Sulfurm X, which I trust completely, has a very precise internal temperature gauge, so you can keep the skin under 42 no problem, and that's going to result in firmer, tighter skin. I mean, we've been using it for years. I have never seen a single case
Yeah.
of fat loss in the face.
Oh, okay. I see what you're saying. Fat loss in the face is the problem that people are
Yes.
talking
So
about.
when we talk about, we get on social media and we talk about our services at the med spa, a lot of my devices have RF in them, and people are like, I'm so scared. I'm so scared about my under eyes losing fat. And
Right.
it did happen to people. And there are some devices that unfortunately are not the best.
Right.
And again, I'll just tell you the ones I trust.
Okay. Yeah.
Sulfurm X is great. We use a device called M-Face, which is great, that uses RF. We use a device called Tempture radio frequency. That's just radio frequency that I use for dry eye. All of these, I have never seen a single case with fat loss because they are proper at keeping the skin in the right temperature zone.
What is it though? Is it just like you turn on your radio and it's like those kinds of like sound waves?
It's a heat-based frequency.
Okay.
So just like a microwave can produce heat, so can radio frequency. It's in our phones, so you're around it all the time.
I should be like looking really good then.
Too much of any heat-based treatment can cause damage, whether it's a laser or radio frequency. You can burn the skin. You can cause fat loss. So you have to really know who you're getting these treatments from. What are their licenses? What are their training? Look at the before and afters. A lot of people just don't do enough research, or they just kind of go with the cheapest price or whatever it might be. So if you do diligence, honestly, half of the devices in aesthetics use radio frequency. So you can't be afraid of them. You just have to understand which ones will give you the results you want.
Okay.
And yeah, we use it a lot in dry eye. In dry eye, because I'm an eye doctor, what happens is people start to get severely dry in the eye, not because they don't make enough tears, but because they don't make enough oil. Oil is coming from the sebum of your skin.
Mm-hmm.
And as you know, when we go through menopause, estrogen goes down, we start producing less and less, or the oil gets sludgy in the eyes.
Ooh.
Okay. So you have these little tear glands and the oil just gets clogged up in there, almost like it needs rotor-rooting. So we use heat, radio frequency heat, to melt the stuck oils and get them flowing again. This can save the glands from atrophying.
Mm-hmm.
So an oil gland that does not produce oil will die. So you can become chronically drier and drier. And I have patients that come in, I mean, they're miserable because their eye just waters all day long. The oil holds the water. So when you have no oil, you water. I mean, I'm sure you've seen like older people with the tissues, or they're always leaking.
I just thought they were really sad.
They're really probably sad. So no, not necessarily, but it sounds hard to believe, but dry eye is incredibly painful.
I bet.
And severe sides of it. So where I come in is I try to educate people to actually have some treatment done before it's terrible. Because once it's terrible, that means you've had gland loss and I can't save them anymore.
Okay.
So we use radio frequency for that. In fat loss, we use it too. So when we amp up radio frequency past 42 degrees, we know we're killing fat cells. And sometimes you want to do that, like on the double chin, or we use body sculpting devices like M-Sculpt Neo for the waist, or wherever you want. So it's good at shrinking fat cells. And sometimes that is the result you want. So it's all about how it's used.
So wait, because I know with lipo, and I don't know what's the other thing that
Kybella.
Yeah. I know someone that's had that twice.
Yes.
Is that removal of fat?
That is the removal of fat cells.
Now, from my understanding, and tell me if I'm wrong, when you remove fat cells, your body has a memory of how many fat cells you're going to have. So you take those out, they're just going to come back somewhere else eventually.
They will have to redistribute. Also, the size of your fat cell can still increase. So you might have less cells, but they get bigger.
But so what you're saying though is with the radio frequency, it's shrinking
It's shrinking it.
And that's not destroying it.
No.
Which is better.
No. I mean, as far as we know, it's not.
Yeah.
It's not really
as far as we know.
I mean, these things are only studied to a certain degree.
I gotcha.
But yes, they will shrink them. And as they get smaller, it will look like you have less fat in that area.
Yeah.
That's the point. When you lose weight, you're often shrinking your fat cells, not actually getting rid of them.
Yeah.
Which is also interesting because that's why people can easily fluctuate back up, because they still have the fat cells. They've just slimmed down in the size. So yeah, so it's radio frequency can be targeted in so many ways. And I think it's great. Again, it's just the operator. A lot of times it's the operator, and there's a couple devices that are a little iffy.
Yeah.
Yeah.
Hold on. Something is, it's this. Is it this?
Is it me?
You have a little tech problem.
I think as I'm talking, I'm kind of moving.
Okay, cool. Well, Maybe. I don't
It
know.
won't move.
Do you hear that? Okay. Anyways. Now,
Let's
okay,
just
we're good.
start over again.
Welcome to Sex, Drugs, and Skincare. Okay, cool. So, so what is like the most typical thing that people come in for the radio frequency?
You know, we use Silpharm X. It's a combination of microneedling with radio frequency. So it's puncturing these little holes in the skin and then sending energy to that layer of the skin. So you get to the deeper layers of the dermis. That's going to help you structurally lift and tone the skin upwards. Another one we use combines radio frequency with muscle stimulation because as you age, the muscles in your face get weaker. And so that's why there's face yoga and a lot of great things you can also do holistically.
Yeah.
M-Face is a very powerful muscle stimulator. It's not like the ones you guys use in estheticians. You use it's microcurrent. That's also similar idea, but imagine 1,000-fold, right?
Yeah.
So it's really strengthening the muscles that pull the face up and then giving it a little dose of radio frequency to tighten the skin so you get a nice non-surgical lift with that.
Okay.
And other devices that use RF, you know, it's a great way to smooth out cellulite. So we have a device called M-Tone. It basically uses shock waves and heat to smooth the skin back out. This is great for people who are like models or they really need to show their body a lot. I'm fine with cellulite personally, but there are ways to smooth it. It will return. It will recurdle. Everyone asks me that. So it's something you kind of do regularly, or maybe if you're going on a vacation and you just want to look your very best.
Right.
So it has a lot of modalities and of course dry eye. It's great for dry eye. So yeah, we use it all kinds of ways. I love radio frequency.
I want to try it.
Yeah. Yeah, it's great.
What would you do, like if you were going to tell somebody what
To start with?
Start with, yeah.
I pretty much guide everyone to do a myriad of a different set of treatments. Up to you when you do them, but if you can do them all within a year or two, you'll see a great difference. So you do Silpharm about 3 times. And so that'll tighten your skin. It'll reduce pigment. It'll shrink your pores. All the things that make your skin look a little duller and older. So it does more than lift and tone. Then M-Face to pull the muscles up. And then, of course, Sculptor, which I know you wanted to talk about.
I did. I want to learn a little bit about it.
Because one is addressing the muscle. One is addressing skin tone and structure, and then Sculptor is volume. So between the 3, a lot of young women are coming in. And when I say young, I mean under 40, like they're 35 to 40, and they come in and they're like, should I just get a facelift? Like my face is just...
A lot of women are getting facelifts lately, which is super
are.
weird. I don't know why.
It's become very mainstream.
Yeah.
They've reduced the price point of it.
Okay.
The thing about facelifts that are important to know is that imagine, obviously, they're pulling your skin upward. That doesn't help tone or texture, doesn't help pore size, radiance. So you won't automatically look all the way younger just because of a facelift. Most people that have a facelift still do other skin treatments. So people often say, should I just? I'm like, well, everything goes together. The other thing is most surgeons will admit to you that, you know, every 7 to 10 years, you might feel like you need a facelift again.
Your gravity still exists.
Right.
Yeah.
So what will help you not need facelifts as early or as often if you're thinking about them are these treatments because you are using regenerative aesthetics to promote your own collagen production. So I firmly believe in that. And, you know, another comment we commonly get is, I'm spending all this money. I should just get a facelift. Again, it's not replacing it exactly.
Right.
It's such a different idea. So when these women come in, 35 to 40 is a good age range to really talk about doing these 3 treatments I talk about. And you will see a really nice result at the end of it. You will be able to notice the difference. It's going to look like maybe not a facelift, but as close as you can get. You're not going under the knife. You've improved your skin texture. And then if you want a facelift, your skin actually is in better quality and condition for it.
Okay.
So there are different ways to go about the whole facelift idea. I think delaying it as much as possible makes sense.
Yeah.
Blepharoplasties have also become really popular.
That is huge right now. Everybody's, I want bleph, I want bleph, I want bleph. I'm like,
you
don't
know,
do it.
As an eye doctor, I refer a lot for that. And honestly, that treatment is very minimal. You don't go under. It's almost like getting a little stitch. They just cut out a tiny sliver of tissue.
Got it.
So I'm not trying to say it's not a surgery, but it's a little bit less invasive of a surgery. And it actually does produce some really nice results.
Yeah.
And a lot of people get very heavy in the lid as they age. Everyone's different with that.
Yeah.
And sometimes the lid gets so heavy, it disrupts your vision. It blocks your pupil.
Well, that's when insurance pays for it.
That is what insurance pays for. But yes, younger people, listen, I've had people that are 20 that said, can I have it? Because of the way their lid is.
Okay.
They want to be able to wear eyeliner a certain way and they want a different eyelid shape. So yes, it's trending to have this like big gap
Yeah.
in your eyelid and be able to wear makeup a certain way. And, you know, I'm not necessarily against it. There isn't a ton I can do in aesthetics to mimic that.
Yeah.
There is a device called OptiLift that can mimic it as close as possible. So I do highly recommend people look into that. It's a mixture of muscle stimulation with radio frequency.
Oh, okay.
But it's right around the eye. So M-Face isn't right around the eyes. That's the muscle stimulation device where you wear a patch.
Oh.
This is like a manual. It's done usually by eye doctors.
Mhm.
And it's actually, it came out maybe last year. It's been showing some really nice results, especially for, you know, the under eye bags some people have genetically.
Mhm.
It helps kind of move the fat downwards a little bit and tighten the skin up so it can really smooth it out
Oh,
without
okay.
considering surgery, especially if you're scared of surgery. That's another thing. Like not everyone
Mhm.
wants it.
Well, I've noticed with the eyes, it's like if you go to the wrong person, it changes your whole face.
Oh, yeah. I mean, blepharoplasties are not eye lifts, so they shouldn't be giving you a whole different look. I know a lot of celebrities, a lot of them are looking different lately. I don't know if, and people are blaming the bleph. I don't think it's
You think
just,
it's like maybe like a lift or something else as well?
you know, who knows what they're doing, but I'm not a big fan of filler in men.
Yeah.
Let's just say
No,
that.
me
It's
either.
very feminizing and it's become trending for men in media, Hollywood, whatever, to get filler. And I think that's what kind of changes their face because it's not a typical characteristic to have super filled round cheeks, you know, and then you do the bleph and then you do Botox. So you're feminizing the face a lot. So male aesthetics have to be approached really differently so that you don't look shockingly different.
Yeah, or like a woman.
I mean, women, and you know, again, a lot of women that you see on TV and movies and models, they have very square jaws,
Mm.
right? They have different anatomy than us normal folk.
Mm.
And so they actually do age quite differently,
Mhm.
right?
Mhm.
So it's everyone's aging is different. And so what aesthetics you use can dramatically shift. That's why the art of the treatment is so important because honestly, like whether it's a surgeon or an aesthetic treatment, you don't want to do things that dramatically change the way you look.
Right.
No one really wants that.
No.
So yeah, so it's, you want to make sure you've seen the doctor's work, that they fully understand your anatomy, right? Because face shape matters. You know, the way your eyes are, your eyelids are, all of it plays a role in how everything's going to
It's
come
an art
out.
for sure.
Oh, for
right?
sure. Actually, a lot of surgeons I know are artists.
Oh, wow.
Yeah, like one of them I know who I refer to, she sculpts. I mean, that's probably not a coincidence, right?
Yeah.
So they have those skills and they really have an artful eye.
Oh, yeah, because they know the anatomy
Yeah.
from when you're
They
doing
know the
sculpting.
anatomy, but also they're trying to create beauty and
Right,
they have
right.
like a vision for it.
Yeah.
So that's also really important. So yeah, research who you go to. Don't think just because someone's famous, they didn't go to the wrong person. I think they do.
I was going to ask you this. Do you know anything? I mean, I know you're going to know, but that was a dumb question. But copper peptides. I have a new
Oh,
product that I've been
yes.
using, and I don't know like what do they do
Yes.
exactly?
Okay. So GHKCU, is that what you're talking about?
Yes.
It's a copper peptide that basically what it does is it initiates the wound healing process.
Oh.
So wound healing will signal fibroblasts, will
Mhm.
produce collagen production. There are different ways you can use it. You can either microneedle it in skin,
Okay.
or you can inject it in your body on a certain protocol, and internally it will cause the same results as a procedure.
What if you just apply it topically though?
The problem with just straight topical without microneedling is the channels of your skin are not open enough to receive it to
Oh.
create an effect.
Okay.
So if you want to put it in your hair for growth, it helps if you microneedle it. It's not that it does nothing because your skin does absorb topicals
Mhm.
just at a very low rate. So you're not going to see a profound difference.
Right.
And these products are not super cheap. You know, good quality
No.
peptides, you want to find a way to get it in your skin in a more direct way to make them optimal.
would you recommend somebody like just go, I hate to say Amazon, but or just go buy like their own little roller and like just the shorter ones and do it on themselves and then put the product on? Or
Those I just worry about contamination.
right.
Because it's hard to clean them and I don't think they're very cheap for the rollers.
Okay.
People are now buying their own skin pens. Again, the only thing with that is you may not, unless you're a medical professional, you may not know how to properly use it. That's one thing. But even if you learn how to properly use it, the difference is when you go somewhere with a medical professional, they can actually go at a depth that you may not be comfortable doing that will produce a better result. So I'm not against at-home treatments, but there is a difference.
Yeah.
In how much the treatment is going to produce a result.
I've had clients ask me if I will do it on them, but I'm not trained in that. So I'm
microneedling.
Yeah.
Yeah. I think past a certain depth, you're supposed to be a medical professional to do it.
Yeah.
I don't really know how everyone's buying them at home. People are buying all kinds of things now. People buy peptides from the internet. You don't really know what you don't know. There could be lead in there. Who knows, right? So it is at our own risk. There's even people doing their own Botox at home.
No way.
They're ordering neurotoxin from China and they go on the internet, they watch a tutorial and they do it themselves.
But how are they going to know they're going to get the right nerves?
I mean, people are willing to now take some really big risks for beauty.
Wow.
Which, and I get it, right? It's a certain price point to have all these treatments done and they are expensive. It's a luxury. Listen, it's a luxury, but it's become a popular luxury. So I don't think it's worth the risk.
No.
I don't think it's worth the risk. I am not a fan of buying peptides from the internet or doing microneedling at home, only because in the worst case scenario, sometimes you're going to get some irreversible damage and I don't know if that's worth it.
Yeah.
But
also, I used to be back in the day, we used to get our neurotoxins from down the street.
Yeah.
We used to know our neurotoxin dealers in the neighborhood. And if people get it from China.
Chug them.
Yeah. Just
drink it.
Yeah.
Just drink
morning neurotoxin.
Yeah. That's why you look so good.
Yeah.
So youthful.
It goes right to his brain, though, unfortunately.
It's the toxins are all in the brain.
Yeah. It paralyzes it.
Yeah.
All right. Well, before we wrap, I just want to ask,
Sculptra.
Please. What is it exactly that it's doing?
Okay. So Sculptra is not a filler.
Mhm.
It's actually a collagen biostimulator and it's injected in areas where you have hollowing or volume loss or even skin thinning.
Okay.
So it's great for people who want a natural regenerative response from their treatments. It will give you a beautiful result because it's nothing cosmetic. It's nothing like going into your skin that isn't your own body.
Okay.
It's great for people with age-related fat loss. A lot of people have been losing a lot of weight on these peptides and they're losing a lot of facial fat volume.
Mm-hmm.
So I love Sculptra for that. There are cases where it's not the best for people if you want an immediate result. So some people don't understand Sculptra works over time.
Yeah.
Gradually, typically it takes about 90 days to see the full result.
Okay.
You can, if you have autoimmune disease, inflammatory conditions, you want to stay away from it.
Why is that?
Because it's causing an immune response.
Okay.
And so you may not have a strong
Mm-hmm.
immune system to deal with these things.
Yeah.
And anybody who doesn't want to follow the protocol, because after Sculptra, you have to actually massage your skin 5 times a day for 5 days for 5 minutes.
Okay.
So you have to constantly move it in the tissue. Otherwise, you won't get an optimal response.
Okay.
Mm-hmm.
You can put it in your cheeks, temples, jaw area. It's really popular in the gels. So if it's applied properly, it can give a really nice lift to the lower face. With Sculptra, you just want to make sure you're going to a very good injector. It is not the product to be price shopping. You want to go to the best because someone might say, why is she 600 and you 1,000? There's probably a reason for that. And it's nothing to do with the cost of the product. It's the skill of the person going in it. So just like anything else, it is an art form. But I love Sculptra.
Yeah.
And typically if there's an area you want to boost the volume in, you're going to do it more than once. You're going to do it a couple of times.
Okay. Yeah. I think a lot of those things too. Don't you would want a series of stuff.
Yes. In most cases, most of the treatments we talked about, you're doing them a couple
I mean, you can't
times.
just work out once and expect that your body's going to be tight for the rest of your life. So.
That's right. One treatment that typically you can do once and you don't necessarily have to repeat a bunch of times are CO2 lasers.
Oh, really?
You'll see a profound result from even one. You may want to repeat it again, but you will see a result from one.
Yeah, and it'll
cool.
last.
It'll last a while, yeah. It's really good at evening your skin tone. And you never even realize how uneven your skin tone was until you have the treatment.
Are you trying to tell me something?
I noticed it myself when I had it done. I was like, oh, wow. It's like a filter.
Yeah.
It's like having a filter on your skin.
Oh,
That's
wow.
what filters kind of do without
Yeah.
you realizing it.
Yeah.
So CO2 lasers are great for that.
Jenn, thank you so much for coming
Thank
in
you.
today and explaining so
Yes.
much. I'm going to have to watch this episode like 14 times because there's so much
I
information.
know. I'm just
Study
yeah, it's really fascinating.
Yeah.
Good.
Yeah.
I'm glad you guys liked it.
Where can people find you on social media? If you want to give
Yes.
out your social security number, that's fine too.
1, 2, 3.
Yeah.
1, 2, 3. Wow.
Whoa.
4, 5, 6. Okay, so I'm at Total Body Aesthetics LA on Instagram and TikTok, and I'm always putting out educational content, so follow me.
All right. Thanks
Yes,
again.
Thank you.
And
Always fun.
Yeah,
Yeah.
it was fun. All right. We'll see you guys next week. Bye.
Bye.